Hi folks, Paddy here from Compass Physio. This week we're going to chat about back pain. So hands up, whoever has had back pain. I've had it in the last week myself. So 8% of the population in Ireland will have back pain at some point, which is a huge statistic. And there's lots of evidence behind the actual cost of ongoing treatment of back pain for the healthcare system. It's absolutely huge. So there's a lot of misconceptions out there about the management of back pain. So in this blog I run through 12 of the key points, 12 of the key topics. I'll just give you a quick overview of them. Back pain isn't something out of the ordinary, so you shouldn't get too worried about it. Key is a correct assessment and diagnosis in the early stages to tell you exactly what's going on and to allay any fears. It's very, very common. That's what you need to remember. Do not rest up and lie in bed. That's an old kind of a management style, which we know now is actually negative for your back pain. So keeping mobile, keeping active. Trying to get as much sleep as you can, which helps the body recover. So if that's appropriate pain relief, but chatting to your GP about pain relief, anti-inflammatories, they do play a big part. Get moving. Exercise is absolutely key. The more you can get active, even the early acute stages when you're really sore, little movements, trying to restore those normal movement patterns, that helps to improve your recovery rate exponentially. MRI scans is the big debate. Do you need a scan, do you not? For me, MRI scan is something that will help if we're looking at progressing a treatment. If we've done the conservative management, we've done some hands-on, you've done some exercise, and symptoms are deteriorating or not improving. Too many people for me rush into MRI scans, and also the findings of the MRI scans, when explained incorrectly, can cause fears. So lots and lots of people, the statistics are in the blog, but lots of people have some small disc protrusions, some wear and tear changes, and these are normal, and these don't always relate to pain. The other thing to consider, what we see a lot of with Compass Physio, is that people come in saying, oh, my spine was out of line or my pelvis was out of place. I don't think I've ever seen anyone, very, very, very rarely does this happen. So it really is about the wording. Going to see a qualified health professional. Obviously we're going to recommend chartered physiotherapist who will advise you on what is actually happening and the best management pathway for you. Surgery, very, very rarely surgery indicated. Majority of people, 85% of people, have symptom improvement after 2 weeks, and after 3 months their symptoms are completely gone. It's a smaller percentage of about 5% of people who have episodes of back pain require further investigations and onward referral and potentially management. So with regard to movement patterns, lifting, bending, lots of people, you probably have a friend who says, oh, I can't do anything, I can't lift that, my back goes every time I do that. So these are common fears that are drilled into people by inappropriate management, and it's something that here at Compass Physio we look to try and allay a lot of those fears and get people back moving normally. Normal movement, we know, is a key part of the recovery process. So that's just a bit of an overview. There's lots more on the blog, and as ever, if you have any questions or you want to chat to us about your back pain or someone you know who's back pain and you want to put them in touch, give us a shout on info@compassphysio.ie. Okay, speak to you soon. Bye bye.